everyone. Thank you for joining us today at our virtual reality Naloxone training webinar. We are thrilled to partner with CACA and Walmart to present this unique experience. CACA launched this simulation in February of 2020 at their National Leadership Forum. Since then, they've held more than 25 virtual screening events and engaged thousands of participants. We look forward to seeing this initiative reach countless more communities. Today, we will hear from a wonderful group of speakers here in Ohio who are working every day to save lives. Then we will view a virtual reality simulation developed by Walmart that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. Our goal is to learn how to use this technology to help communities, leaders like you, save lives and create a norm that every life is worth saving. Now I am pleased to introduce our first speaker, CACA's Chief Operating Officer, Valentino Murphy. Valentino joined the CACA team in 2021 and has been working ever since to help further their mission of building and maintaining safe and healthy drug-free communities. We are thrilled to have him with us here today. Valentino?
Hello, everyone. I'm thrilled to be here. First, I want to extend my gratitude to Walmart for the commitment to saving lives through this innovative training. For some of you, this will be your first time using a VR headset. If so, I encourage you to embrace the experience and the training that comes along with it. And yes, your head will be moving around. I'd also like to thank our friends and supporters at the Department of Mental Health and Addiction Services. It's an honor to be here alongside such remarkable leaders from the great state of Ohio. CACA has a footprint in over 30 countries and more than 7,000 coalitions across the United States. We work with community residents and leaders to develop coalitions and reduce substance misuse by adapting CACA's model for community change. CACA knows that prevention is the most cost-effective way to reduce substance use and misuse. The emphasis on prevention is more crucial than ever. The CDC reported that there were over 107,000 fatal drug overdoses in the United States in 2023. So let's put this in perspective. That will fill every seat at home game for the Browns or the Bengals more than 1.5 times. This is why leaders and community stakeholders like yourselves are crucial. You are really the true heroes in driving positive change. Our partners at the Drug Enforcement Administration continued their One Pill Can Kill campaign, which raised awareness about fentanyl-laced pills that are killing so many fellow Americans. In 2023, the DEA seized more than 80 million fentanyl-laced fake pills and nearly 12,000 pounds of fentanyl powder. The 2023 seizures are equivalent to more than 381 million lethal doses of fentanyl, more than enough to kill every American. Their message could not be clearer. The only safe medications are the ones prescribed by a trusted medical professional and dispensed by a licensed pharmacist. As DEA Administrator Ann Milgram shared at CACA's 2023 National Leadership Forum, this is not a war on drugs, but a fight to save lives. We also need to be vigilant of trends popping up in our communities. Our partners at the Office of National Drug Control Policy have identified xylazine, or also known as tranq, as a key emerging threat and has been identified in all 50 states. It interacts with opioids in a devastating way that leads to overdoses. In a report to the White House, the Office of National Drug Control Policy stated that community-based programs will be amongst the first to interface with individuals vulnerable to fentanyl contaminated with xylazine. In this current landscape, we need every available tool to save lives and help our communities recover from this drug crisis. This gathering today and the Walmart-sponsored innovative training is a huge step forward. Keep up the good work. I look forward to seeing you soon. Bye.
Thank you for joining us today, Valentino, and for all your leadership across CACA in this work. Turning to our wonderful group of speakers from Ohio, we're happy to introduce you to Tia Marcel Moretti. Tia Marcel Moretti served as Chief Advisor for Ohio Department of Mental Health and Addiction Services, bringing 22 years of experience working in the community-based mental health and addiction space. Prior to joining Ohio MOS team, Ms. Moretti was the founder and CEO of the Ohio Institute of SUD Excellence, a nonprofit trade organization comprised of addiction providers who are committed to transparently reporting outcomes and collaborating to implement a standard of care in addiction treatment. Ms. Moretti is also a licensed social worker, Ohio Certified Prevention Consultant, and formerly served as the Associate Vice President of Behavioral Health Integration for CareSource. Prior to joining CareSource, she worked for the Office of the Ohio Governor, Mike DeWine, and the Deputy Director of Recovery Ohio, coordinating the $20 million investment in K-12 prevention education and managing mental health grants in all state departments, and tracking more than $200 million allocated for mental health and addiction services. As the Director of Substance Use and Social Services Policy for the Ohio Attorney General's Office, she worked with organizations to identify solutions around the opioid crisis, co-authored the Drug Use Prevention Resource Guide, and implemented the first police-led youth drop-in center. Tia, we are looking forward to hearing from you.
Hi, I'm Tia Moretti, Chief Advisor at the Ohio Department of Mental Health and Addiction Services. I'm excited to talk to you today about two things I'm very passionate about: harm reduction strategies like naloxone use, and how to use and have conversations surrounding using them. I've worked in the mental health and addiction field for more than 25 years, including 10 years in state government. It's been incredible to see naloxone become more available and accepted. The shift is helping us better support people in their recovery journey and helping to keep more people alive so they can recover. Naloxone is an effective, life-saving tool. It is a critical resource for individuals at risk for opiate overdose. The accessibility today and use in emergency situation has been one of the drivers to addressing the rates of overdose in Ohio's communities. The expanded availability of naloxone has also contributed to changing perceptions surrounding addiction and reducing stigma. As awareness has grown in Ohio about the effectiveness of this medication, it has fostered a more compassionate and understanding of those affected by the substance use and substance use disorder. At the Ohio Department of Mental Health and Addiction Services, our goal is to help Ohioans and their families be well, get well, and stay well. Under the tremendous leadership of Governor Mike DeWine, we have made giant strides in the fight against overdose and in reducing unintentional overdose deaths. The Ohio Department of Mental Health and Addiction Services has coordinated with statewide partners, sister state agencies, and Governor DeWine's Recovery Ohio initiative to identify Ohio's goals for addressing substance use and abuse. And those goals include reducing unintentional overdose deaths, increasing access to addiction treatment, preventing youth alcohol and drug use, increasing recovery supports, reducing stigma, supporting responsible prescribing practices, and promoting harm reduction strategies and practices. These goals and strategies have been aligned to provide a coordinated response to Ohio's opioid epidemic. A variety of data collection methods were used to collect data for this plan, including surveys, focus groups, roundtables, interviews that included people with lived experience and state leadership, providers, and advocacy organizations. The collection of this information has driven our plan and our success and our reduction of stigma in the effort to make this drug more available. One way we've reduced opioid overdose deaths in our state is by expanding access to naloxone statewide. Naloxone kits have been distributed to first responders, law enforcement agencies, community organizations, and individuals at risk of overdose. We have put naloxone and naloxone resources in the hands of our patients when they are discharged from one of our 6 state-run psychiatric hospitals. We've launched the naloxone.ohio.gov website where Ohioans can get free naloxone kits. And we've created Project Dawn, which stands for Deaths Avoided with Naloxone. This is a network of naloxone and fentanyl test strip distribution programs coordinated by the Ohio Department of Health. We now have over 420 Project Dawn programs operating in 82 of our 88 counties. Recognizing the importance of preventing unintentional overdose deaths, Governor DeWine has declared August 31st as Ohio Overdose Awareness Day in an effort to raise awareness, support communities in the fight against drug addiction, and honor the lives that have been lost to the opioid epidemic. Also, in response to the growing prevalence of fentanyl-related overdoses, Ohio has increasingly utilized fentanyl test strips to help individuals detect the presence of fentanyl in the drugs before they are used. As a result of these efforts, there was a 5% decrease in the number of unintentional overdose deaths in 2022 compared to Ohio's record total of 5,174 unintentional overdose deaths in 2021. And early numbers indicate yet an even greater decrease in 2023. We are very encouraged by these numbers. They show that our efforts are having a positive impact of the lives of the individuals in our communities. At the state level, we're partnering with our communities and using data to help Ohio move from struggling with the opioid epidemic to successfully overcoming it. It's working. In 2022, there was a 5% decrease in the number of unintentional overdose deaths in Ohio compared to the record total of 5,174 unintentional overdose deaths in 2021. And early numbers indicate even fewer people lost their lives to overdose death in 2023. We are encouraged by these numbers. They show that our efforts are having a positive impact on the lives of the individuals in our communities. We all have a part to play in reducing overdoses and saving lives. Knowing the warning signs of an overdose, learning what to do if one happens, and carrying naloxone can help make a difference. I'm encouraged by this effort. I'm encouraged by all of us coming together as a nation and as a state to reduce stigma, save lives. Thank you for watching this video, and thank you for doing your part.
Thank you, Tia. That was an excellent survey of all the great programs we are leading across the state and a great reminder of the progress we're making. Your leadership and experience here in Ohio is so valuable to making a difference in the lives of Ohioans and to help us all reach the next level. Our next speaker, Douglas Spain, is the Drug Demand Reduction and Outreach Program Manager for the Ohio National Guard Counter Drug Program. He oversees a team of 10 soldiers and airmen assigned to various prevention organizations throughout Ohio. In that position, he is assigned to the Ohio Department of Mental Health and Addiction Services. Douglas Spain entered service in 2002 as a member of the Ohio Army National Guard. He served in the ranks of private through master sergeant in the 112th Transportation Battalion. He is currently the operations sergeant major for the Ohio Army National Guard 16th Engineer Brigade. Douglas Spain is the 2021 graduate of the U.S. Army Sergeant Major course and a 2017 graduate of the NCO Leadership Center of Excellent Commandants Pre-Command course. Some of his military awards and decorations include the Meritorious Service Medal, the Army Commendations Medal, the Army Achievement Medal, and the Ohio Accommodations Medal, and the Combat Action Badge. Doug, please take it away.
Hi, my name is Douglas Spain, representing the Ohio Department of Mental Health and Addiction Services. I want to take a couple minutes of your time today to highlight some of the work happening here in Ohio centered around drug prevention, specifically our relationship with the Ohio National Guard Counter Drug Program. The Counter Drug Program employs men and women, both the Army and the Air Force, and assigns those personnel to community-based prevention coalitions and organizations. Currently, the Counter Drug Program provides full-time support to 10 prevention agencies and over 25 community-based organizations in a part-time capacity. Depending on the organization or the partner, the scope of work differs, but ultimately the goal is to enhance organizational capacity and support the mission the initiatives, anything that that organization is doing at the time as it relates to drug prevention. Some key highlights recently that have taken place within the Ohio National Guard Counter Drug Program are take-back events. We do support twice a year the DEA's National Take-Back Day. We provide manpower, logistical coordination, transportation. But in addition to that, we also support local take-back days at the community level, where we're able to work with local law enforcement agencies. And we do a lot of promotion to ensure that it is possible to conduct these events. And doing so ensures that unused, unwanted, or expired prescription medication is out of the household and disposed of properly. Additionally, the Counter Drug Program has personnel assigned to schools who deliver evidence-based curriculum in both middle and high school. This past academic year, Counter Drug personnel educated over 4,500 students on living a healthy lifestyle, making healthy decisions, and in doing so are shaping our future leaders. Also, a key element of the work that is being done is cross-coordination between law enforcement agencies and the community-based prevention organizations. We do this by leveraging our relationship with the law enforcement agencies through our assigned analysts. And we look at location data, substance data, and we determine what the actual real threats are in communities so that we're able to work with the prevention organization and help them determine the right initiatives and the right efforts to make sure they're attacking the real problem versus what may be a perception. And we do this collectively. This is not a battle, a fight that can be won by an individual. We all have to complete our puzzle piece and then, work across sectors to ensure and help others in completing their puzzle piece as well. Additionally, in Ohio, we're heavily involved in the distribution of the Deterra destruction bags. Up in Northeast Ohio, a National Guard member manages a program and ensuring those are getting handed out within communities. And there's a need for them and a want for them within communities. And that's just another way we're ensuring these drugs aren't getting into the water systems and they're being disposed of properly and not into the wrong hands. In addition to that, we do support standalone events by request, and that is a community engagement opportunity, and more specifically youth engagement. We may show up at an awareness day and support a booth or sit at a booth, and what that does is draws folks in. We engage in conversation, and then we introduce them to the community sponsor, the coalition, whomever is putting on the event. And we start to build those relationships early to ensure that the youth understand, one, these events happen, they're out here, but also these agencies and these people are out here, these resources are out here. So it's just a small way that we help in spreading awareness and building and creating and maintaining relationships. Again, those are just a couple quick highlights of some of the prevention work being done by the Ohio National Guard Counter Drug Program. And it is in great partnership with our state agency and community coalitions at the local level. We've been successful thus far, and we're only looking to expand and build more relationships and determine more ways that we can work with you to expand the possibilities. I appreciate your time today.
Thank you, Doug. We are so grateful for your work and the impact of the Ohio National Guard Counter Drug Program, helping reach youth and tie local enforcement efforts with coalitions has helped amplify all of our efforts. We're happy to share with our attendants today that in April of 2024, Drug Take-Back Day, Ohio hosted nearly 300 take-back sites. And to date, we have collected more than 920,000 pounds of unneeded and expired medication through Drug Take-Back Days. We hope everyone will take advantage of this coming Drug Take-Back Day on October 26th. Our next speaker, Hamed Hazmi, served as the Assistant Director with the Ohio State University's Office of Student Life Student Wellness Center. He oversees the alcohol and drug initiatives of the center, providing leadership to the center staff who support students in making healthy choices regarding drugs and alcohol. Born and raised in Ohio, Hamed enjoys being a Buckeye and looks forward to continuing to be inspired by the students achieving success at The Ohio State University. Hamed received his Bachelor's of Science degree in Community, Family, and Addiction Services from the Texas Tech University and holds a Master's of Social Work degree with an emphasis on addiction prevention and treatment from The Ohio State University. Hamed is currently pursuing a doctorate of education with a focus on higher education and student affairs. Hamed is a member of the board of directors for the Associates of Recovery Schools. Hamed, we're so excited to hear from you and learn more about your work.
Hello, my name is Ahmed Hassani, and I use the pronouns he, him. I'm an assistant director at Ohio State University's Student Wellness Center and the director of recovery at the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. I have the really cool opportunity of working with college students every day to help them understand the effects of drugs and alcohol in their lives, including their academics, relationships, and their physical and mental health. For many college students, being on campus is the first time they are living outside of the care and supervision of their parents or family. It's also the first time that some will be introduced to drugs and alcohol. And contrary to popular belief and societal expectations of college students, many students are going to make the decision to refrain from using drugs or alcohol. Some are going to delay using it until they're of legal drinking age, and some are even going to only drink on occasion and socially. But there will be others who develop patterns of drinking and drug use which lead to negative consequences. For those who begin using substances in ways which are problematic, like binge drinking or using illicit substances, or maybe even misusing their prescription drugs, opioid prevention is important to help them avoid life-altering and potentially fatal experiences. When we look at the research around college student drug and alcohol use, 3 substances are most commonly used: alcohol, cannabis, and prescription drugs. The prescription drugs range from opioids intended for pain relief to amphetamines, which are prescribed for things like attention deficit disorder and narcolepsy. Students make the decision to use drugs for lots of different reasons. Our job is to help them be as safe as possible if they do decide to use. With the presence of fentanyl in the drug supply, it is important that we provide students with the education and resources to make the healthiest decision possible. What that means is teaching them that using any illicit substance or prescription drug that they obtain from a dealer on the street or even friends could contain fentanyl, and that the only prescription drug that is safe to use is a prescription drug that they get from the pharmacy. We have seen examples of students across the country using a drug that they believed was safe from fentanyl exposure, things like cocaine or prescription drugs, and yet they experienced an overdose because it was contaminated with fentanyl. Due to the high rates of binge drinking and drug experimentation on campus, opioid prevention should be a priority for all campuses. Campuses should help students stay safe and avoid a life-altering experience by making naloxone and fentanyl test strips available to them in a way which is judgment-free and easily accessible. Help students at your alma mater or a campus near you by checking if that university is distributing naloxone and other harm reduction resources. If not, contact them and let them know about what you learned here today, that no drug use is safe for college students, and that it's the responsibility of universities and their local communities to make sure that students have access to the resources they need in order to be safe and to thrive. And for the universities who want to learn more about these types of services and providing access on campus, they can visit the Higher Education Center's website at the hecaod.osu.edu to learn more about opioid prevention on campus. Thank you.
Thank you, Hamed. Your work at the Ohio State University is setting an example for all schools on how to help students make healthy choices during such a vital transition in their lives. And we appreciate how proactive you are in working with all students for their own best outcomes. Our final guest speaker, Sarah Sawmiller, is the Senior Director for Data Integration at Prevention First. She is an Ohio Certified Prevention Consultant and a Certified Health Education Specialist. Sarah oversees the implementation of the biennium Prevention First Student Survey, all assessment and evaluation related strategies, and many of Prevention First prescription drug misuse prevention programs. She is an Ohio Coaching and Mentoring Network trainer, a provisional trainer for Sources of Strength, secondary, and a PACS partner. Sarah is a 2019 graduate of the Community Leaders Institute and holds a Bachelor's of Science in Health Education with a focus in public and community health, as well as a Master's of Public Health with a concentration in biostatistics, both from the University of Cincinnati. Sarah, thank you so much for joining us.
Hi, I'm Sarah Sawmiller. I'm the Senior Director of Data Integration at Prevention First, and I'm excited to get the opportunity to speak today about some of the work that we have done at Prevention First and in the communities across Ohio. In the field of prevention, we often reference the phrase, "nothing about us without us." And this is why community-based strategies and community coalitions are integral to our work. We know that the biggest changes happen when communities and individuals come together and work towards a common goal. And this is why local coalitions have worked for many years to build protective factors and reduce risk factors for substance use. So as the effects of opioid misuse and abuse started to really spread throughout communities in Ohio, we saw many local coalitions reaching out, asking for, information and resources and to support their prevention efforts. And we also saw a lot of communities reaching out saying, "Hey, I'd like to start a new coalition. How can we get involved? What can we do about this?" So our first line of strategies that we put out when when the opioid addiction and misuse started to spread was information dissemination and education. So those were kind of our two first key focuses. Data showed that many individuals that were being prescribed opioids weren't aware of the dangers or the risk of addiction that were associated with this medication. And additionally, data indicated that a lot of individuals weren't really informed on what an opioid was, why you shouldn't share medication, things like how to read a medication label. So we definitely knew that there was a lot that we had to do around educating and informing the public around everything that was going on with the opioid epidemic and how to make those safe choices. So we worked with our existing coalitions to decide on the best media approaches for their community to get that message out. And you want to work directly with the communities because it's important to make sure that are they a community that everybody still reads the newspaper? Because if so, that's a great way to do it. But others, it might be social media because everybody's really, connected through Facebook groups and things like that. And then for a lot of those new communities that were looking to build coalitions, we helped them engage their stakeholders and then work through the strategic prevention framework to decide and then implement what were the best practices that were going to work best for their community. Once education and awareness began to grow, we started to incorporate environmental strategies like access and availability reduction. This looks like mechanisms for proper disposal, like Deterra bags, Destroyer, RX Destroyer, Dispose RX. Those are at-home options, as well as medication drop boxes out in the community, like at your local pharmacies or police departments. And it also looks like local drug take-back days as well, where community members can bring their medication to a central location to dispose of them properly. Many partners across the state have come together to address this need specifically to provide these resources. So In Ohio, you're able to go to ohiorxdisposal.com and you can request a doTERRA bag to be shipped directly to your house at no cost. And that's thanks to grant funding for the state. And then we also have an initiative to increase the number of medication drop boxes in pharmacies, police departments, and sheriff's offices around the state so that everybody has easy access to medication disposal. Another access and availability strategy is safe storage. So this looks like providing the knowledge and resources to individuals to make sure that they are able to lock up their medication, that it's out of view from any strangers that may be in their home, and that it's out of reach from any young children and pets. And when we talk about access and availability, this goes hand in hand with stigma reduction. Substance misuse prevention isn't about making it more difficult for individuals to get the prescription medication that they need. It's about reducing access to those who may intentionally or unintentionally misuse it. And stigma reduction has been a large part of our community-based efforts, whether that's advocating for access to treatment, whether it's making sure that everything on the other side of the continuum care is accessible to everybody in the community, and making sure that there are social norms around talking about prescription drug misuse, especially talking about prescription drug misuse with your young people. That's a big piece of stigma reduction that Prevention First work towards. We want to create social norms because we know that social norms is what drives sustainability in our communities. So we want it to be a norm that kids grow up talking about safe medication use with their parents and guardians. We want it to be a social norm that young people see their parents cleaning out their medication cabinets at the same time that they're checking their smoke alarms. We want to see it be a social norm that children grow up watching their communities come together to solve problems when they happen in the community. These are the type of norms and strategies that lead to sustainability. And if these strategies and norms are sustained, that can lower the rate of substance use in our communities and lead to healthier communities overall. So our mission here at Prevention First is a lot of things, but when we look at prescription drug misuse, we want everyone to know that they have a role in prevention. And so I encourage everyone to go out and get involved in their local coalition or figure out what that role looks like for them.
Thank you, Sarah. We appreciate the leadership that you and all of Prevention First show throughout Ohio. Your consideration of how coalitions can engage their actual community stakeholders on their own terms help our prevention professionals make real change in the community. Thank you so much for joining us and sharing your time. Thank you again to each of our speakers today. They are doing so much to raise awareness and expand services in this challenging environment. And now we will view the overdose prevention simulation portion of this event. Walmart has invested in virtual reality equipped training for their associates to build skills in unique situations that are hard to replicate in a classroom setting, like a front of the store shopping experiences and emergency preparedness simulations. This technology led to the development of a non-retail training such as VR, which we will see next. Let's take a moment to view this training.
Dude, guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today we're going to teach you to spot the signs of an overdose and administer Naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Yo, Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's the emergency?
Yeah, hello? I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that hers? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh, no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me. All right, hotshot. I hope you're paying attention. It's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone.
Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor.
This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting Naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
Thank you to the Walmart team for developing the powerful tool we are so excited to work with to connect this resource with community members. We want to extend our thanks to all of our speakers and participants for attending this event. We truly appreciate your time and insight. We also want to thank our friends at CACA, especially Mia Wallace and the development and membership team that helped support this event. Please take a moment to learn more about their work in building a safe and healthy drug-free community. And finally, thank you so much for all of our members and supporters of our local Ohio coalitions and their community level partners. We are achieving so much meaningful change in Ohio, and the future of our great state is truly bright. This concludes our webinar. I wish you all a great rest of the week.